Morning again. Thank you all for being here today. I think you'll agree with me that we've heard this morning opportunities for remarkable convergence and opportunity. I don't know that any of us would have imagined when we had all of the optimism some years ago about the prospect for finally getting organized healthcare in this country and the early days of the Affordable Care Act were being configured, that things would have been dashed so quickly with the words we've heard this morning about death panels. And that those words would have triggered an anonymous donor in some way to think about the importance of the Institute of Medicine engaging in this important dialogue that we've been having today. Now, as you know, the Institute of Medicine really stands as perhaps the nation's leader in terms of really trying to develop data-based, evidence-based approaches to dealing with complicated problems. And when we began our work at the Institute of Medicine on the report that we've been talking about today, we wouldn't have recognized that Atul Gawande was writing a book that would have also changed the dialogue in such an extraordinary way. So at this moment, the convergence is that the IOM and Dying in America was reported at the end of 2014 and came forward with a series of recommendations to change the ledger about how we as individuals and we as a nation approach dying in America. And Atul, in his very special way, has, as we've said, humanized and told us the reasons why this is so important. So I think that the opportunity today is really to ask ourselves as a group of members of communities and constituencies how we can lead this change. So we have assembled this morning a really exceptional panel, so-called stakeholders, individuals, leaders who can really have a shaping effect on how the Institute of Medicine and we as a nation implement these important recommendations. We have on the panel, and they will speak, each of them, for about 6 minutes, and then we'll move to a dialogue and discussion, some remarkable people. Chris Castle, who parenthetically was the person who led Approaching Death, the 1997 report, is currently the president and CEO of the National Quality Forum. Pamela Cipriano is the president of the American Nurses Association. Donald Shoemaker is the president and CEO of the National Hospice and Palliative Care Organization. Scott Shreve is the National Director of the Hospice and Palliative Care Program for the Department of Veterans Affairs. Richard Umbenstock is the President and CEO of the American Hospital Association. Robert Waugh, President of the American Medical Association. And Stephen Weinberger, the Executive Vice President and CEO of the American College of Physicians. So if we need to make change, certainly in terms of constituent groups of stakeholders, we could do it right this morning. We've got everybody right here at the table. And what I've asked each of them to do is to really reflect with us, in fact, how they're going to do that, how they and their discipline and their organizations are going to respond to the recommendations of the Institute of Medicine so that we can move this agenda forward. So Chris, let's start with you, and then we'll move to each of the panelists in sequence, and then we'll come to an open dialogue.